Try not to bore y'all to death. First off, I just want to say thank you guys for letting us come and talk. It really means a lot, and hopefully we'll do good on our community presentation. So my name is Skylar.
I'm Chelsea. And I'm Genesis.
Okay, and today we're going to be talking about why oral health is important. All right, so first, to understand why the oral environment is important, we first have to understand what the tooth structure is composed of and how it works. So this first layer, we have the enamel. This is the hardest substance in the whole body, but it still has the ability to be worn down by any acidic foods or any kind of fermentable carbohydrate that we eat can dissolve it. Dentin is the second layer right here. So this is a little bit softer than the enamel, so it's a lot easier for any kind of cavities to penetrate. We'll see a little bit more about that in the future. And then we have our pulp. This is where all of our feelings come from. And then we have the cementum. Now this is a very big role. So the cementum is the outside covering of the tooth that's in the bone. This is softer than enamel, and it's more prone to have sensitivity or a lot of other harmful effects. All right, so as we can see here, we have a picture of caries. Caries and cavities are interchangeable, so I might say two interchangeably between. So this is a picture of one a little bit more advanced. And then we'll watch a quick video.
I said I'd never join.
Nobody wants to join that way. Joining the Navy sounds crazy.
Saying never actually is.
When a team of archaeologists recently came across some 15,000-year-old human remains, they made an interesting discovery. The teeth of those ancient humans were riddled with holes. Their cavities were caused by the same thing that still plagues us today, specific tiny microbes that live in our mouths. These microbes are with us soon after birth. We typically pick them up as babies from our mother's mouths. And as our teeth erupt, they naturally begin to accumulate communities of bacteria. Depending on what we eat, and specifically how much sugar we consume, certain microbes can overpopulate and cause cavities. Diets high in sugary foods cause an explosion of bacteria called mutans streptococci in our mouths. Like humans, these microorganisms love sugar, using it as a molecular building block and energy source. As they consume it, the bacteria generate byproducts in the form of acids, such as lactic acid. Mutans streptococci are resistant to this acid, but unfortunately, our teeth aren't. While each human tooth is coated in a hardy, protective layer of enamel, it's no match for acid. That degrades the armor over time, leaching away its calcium minerals. Gradually, acid wears down a pathway for bacteria into the tooth's secondary layer called the dentin. Since blood vessels and nerves in our teeth are enclosed deep within, at this stage, the expanding cavity doesn't hurt. But if the damage extends beyond the dentin, the bacterial invasion progresses, causing excruciating pain as the nerves become exposed. Without treatment, the whole tooth may become infected and require removal, all due to those sugar-loving bacteria. The more sugar our food contains, the more our teeth are put at risk. Those cavemen would hardly have indulged in sugary treats, however. So what caused their cavities? In meat-heavy diets, there would have been a low risk of cavities developing because lean meat contains very little sugar. But that's not all our early human ancestors ate. Cavemen would also have consumed root vegetables, nuts, and grains, all of which contain carbohydrates. When exposed to enzymes in the saliva, carbohydrates get broken down into simpler sugars, which can become the fodder for those ravenous mouth bacteria. So while ancient humans did eat less sugar compared to us, their teeth were still exposed to sugars. That doesn't mean they were unable to treat their cavities, though. Archaeological remains show that about 14,000 years ago, humans were already using sharpened flint to remove bits of rotten teeth. Ancient humans even made rudimentary drills to smooth out the rough holes left behind, and beeswax to plug cavities, like modern-day fillings. Today we have much more sophisticated techniques and tools, which is fortunate because we also need to contend with our more damaging, sugar-guzzling ways. After the Industrial Revolution, the human incidence of cavities surged because suddenly we had technological advances that made refined sugar cheaper and accessible. Today, an incredible 92% of American adults have had cavities in their teeth. Some people are more susceptible to cavities due to genes that may cause certain weaknesses, like softer enamel, but for most, high sugar consumption is to blame. However, we have developed other ways of minimizing cavities besides reducing our intake of sugar and starch. In most toothpastes and many water supplies, we use tiny amounts of fluoride. That strengthens teeth and encourages the growth of enamel crystals that build up a tooth's defenses against acid. When cavities do develop, we use tooth fillings to fill and close off the infected area, preventing them from getting worse. The best way to avoid a cavity is still cutting down on sugar intake and practicing good oral hygiene to get rid of the bacteria and their food sources. That includes regular toothbrushing, flossing, and avoiding sugary, starchy, and sticky foods that cling to your teeth between meals. Gradually, the population of sugar-loving microbes in your mouth will decline. Unlike the cavemen of yesteryear, today we have the knowledge required to avert a cavity calamity. We just need to use it.
All right, we tried to pick a video that wouldn't bore you guys to death. All right, so as I mentioned before about the enamel being the hardest substance in the body, this is a picture of the enamel a little bit more severely once it's been worn down. So we see this a lot of times in people who consume a lot of sugary beverages or foods, or maybe aren't practicing the right amount of oral hygiene. It can progress. This is often super sensitive, and once that enamel's gone, there's no bringing it back. It's gone. You got to live with that forever. Y'all didn't think that was funny? Tough crowd. All right, so we're gonna break into what is gingivitis. The most trickiest thing here for y'all to remember is that gingivitis is periodontal disease, but often periodontal disease is used interchangeably with periodontitis. Because periodontitis and gingivitis are both periodontal diseases, usually periodontal disease is used to describe the more significant term, periodontitis, but if it is used interchangeably, just hang on in there with us. So, gingivitis is a gum disease and a form of a periodontal disease that typically causes mild symptoms such as edema and erythema. Bacterial buildup around the teeth is the most common cause of gingivitis. Gingivitis is likely to progress into a more severe condition if left untreated. According to the CDC, 47.2% of adults aged 30 years and older have some form of periodontal disease. Periodontal disease increases with age. 70.1% of adults 65 years and older have periodontal disease. So right here we can see this is what healthy gum should look like. So we often use the term pink or stippled like an orange peel. So it shouldn't be red, inflamed, and super shiny. So once we see that, that's when we know that there's maybe a little bit more going on. Oral hygiene isn't being properly used like it should be. If you bleed when you floss, you have gingivitis. So here we can see, again, the gingivitis versus the healthy gum. All right, and then here's just another picture to show that bacterial buildup and the inflammation accompanying this. Now, a lot of you guys may be thinking, oh, like, it's gingivitis, like, you know, like, my gums bleed a little bit. Not only because it has that link to progressing into periodontal disease later, but also, as we know, that is our immune system fighting off stuff. We want our immune system to be protecting our patients with the other needs that they have going on. We don't need all those white blood cells concentrated in the gum areas. We need them off in the other parts of the body fighting. Now, other risk factors with gingivitis include poor oral care habits, smoking, dry mouth. You know, as you guys know by now, almost every medication has xerostomia as an effect. Then we've got defective dental restorations. So letting it cling, that bacteria will cling up if there's like a little bit too much of that restoration hanging off of the tooth. Diseases such as cancer and HIV, genetics can play a big role in it. Crooked teeth that are difficult to clean around, like crowding. Age, certain viral and fungal infections, that oral medications, and poor nutrition. All right, so we're about to dive into that periodontal disease that I was talking about. So here we have normal gums, gingivitis, periodontitis. So, and we can skip to the next. Gingivitis progresses to periodontitis when we have a loss of bone. So eventually, the bone almost wants to run away from any type of calculus. We know first we eat a French fry. We don't brush that French fry off of our teeth. It takes 4 to 14 days for calculus to form from plaque, or tartar is also another word used for calculus. Once that calculus sits on that tooth for too long, this bone's like, uh-oh, let's move away from it. So the bone starts to deteriorate. This causes problems like mobility, periodontitis, a whole bunch of problems that we don't want. When that bone is gone, you're not growing that bone back naturally. Now there is some surgeries you can do with like a bone graft, but overall you want to keep the bone levels intact. So periodontitis is a form of periodontal disease, often caused by ongoing gum disease, gingivitis. It causes the pockets to develop between your gums and teeth that fill with plaque, which gets transformed into the hardened plaque called calculus. These pockets are going to just keep going deeper and deeper and deeper and deeper until it can no longer be cleaned with a toothbrush, and now you require non-surgical therapy, or what most of you guys may have heard of as a deep cleaning. When now we've got to go in and we've got to clean those roots because bone ain't protecting them roots no more. That bone is gone. So you've got all the opportunity for that bacteria to just start seeping into those gums and make the problem get worse. If not treated, these deep infections can cause a loss of tissue and bone, and ultimately you may lose 1 or more teeth. And here we have again, also ongoing chronic inflammation can put a strain on your immune system. So here we have again the picture. So we have the healthy bone levels are right covering that cementum. So the enamel is what is free. We have the bone covering that cementum. Now here we see these bone levels have started to drop. When that bone level drops, those gums drop. Now you have what exposed? Cementum. And if y'all can remember from before, cementum is going to decay a lot faster than enamel because that cementum is not as strong as that enamel. So now you have sensitivity, and you are more prone to mobility, and you are more prone to cavities. And it's just, if it falls out, now you've got a problem with having a space there. Now your teeth are going to start shifting, and it's going to be malocclusion, and then more teeth start having to pop out. So that gingivitis isn't just gingivitis. When down the road, that gingivitis leads to a lot of things. All right, so what we've handed you guys all is a pamphlet of some of the how oral health and systemic health are related. So we got you guys a pretty little color copy to look over. All right. So, why does this pertain to you guys? Who has heard of the term interprofessional collaboration? Perfect. So, our job as a dental hygienist is to screen patients for any other systemic issues that they may have going on. The link between oral hygiene and health. As you can see on that paper, almost every condition can have some kind of tie-in to the oral environment. So, when you guys... In the future, when you have these patients coming in, oral health, asking them, are you seeing a hygienist regularly, is the same as us taking blood pressure on our patients when they come in. So, interprofessional collaboration is the key term for you guys to remember. And now, Miss Chelsea is going to take over.
All right. So now I'm sure you want to know how are we going to prevent those cavities and the diseases Miss Schuyler was talking about.
Now that I've done scared y'all.
And so we do that with proper oral care. Okay. So just some general oral health statistics. So 75% of millennials only brush their teeth once a day. 42% of adults report visiting their dentist less than once a year. Only 4 out of 10 people floss daily, and 20% of individuals do not floss at all. And then 40% of children under the age of 3 have never been to the dentist. So now we're going to show you how to brush your teeth.
In this video, we'll show you the best way not only to brush your own teeth, but also how to easily brush the teeth of others. Toothbrushing should be carried out twice a day, in the morning and last thing at night. We must remember that not everyone can brush their own teeth. But when brushing other people's teeth, the principles are the same. Please remember that toothbrushing takes a full 2 minutes. Yes, 2 minutes. Use a small-headed, medium texture bristles toothbrush with a small amount of fluoride toothpaste. Start by tilting the toothbrush against your teeth so the bristles are at a 45-degree angle to the gum line. Move the brush in small circular movements, a few times on each tooth. Next, brush the outer surfaces of each tooth, keeping the bristles angled against the gum line. Do the same thing for the inside surfaces of all the teeth. Now, brush the biting surfaces of the teeth, on the top and the bottom. To clean the inside surface of the front teeth, tilt the brush vertically for the upper teeth. Gently move the brush long ways down the tooth from the gum for a few seconds. For the lower teeth, tilt the brush vertically and pull the toothbrush gently upwards from the gum for a few seconds. If plaque is not removed from the teeth, it leads to bleeding gums and tooth loss. If you eat or drink sweet things, plaque mixes with the sugar and causes tooth decay. Finally, spit out any remaining toothpaste. Do not rinse the mouth with water or any kind of mouthwash. In this way, the fluoride in the toothpaste will help protect the teeth.
Good question. So we don't rinse your mouth after brushing? No?
Mm-hmm.
No, you want the fluoride to sit on your teeth so that you can brush it more. I know.
Well, what about the mouthwash?
Well, it's for feet, it has fluoride in it.
Yep. Mouthwashes are available with fluoride in them, so if you did want to use mouthwash, we would recommend doing it before brushing or doing it after with the fluoride.
No, my dentist told me I had to do before. I had dreams about losing teeth, so you know, they got to get yourself together.
Okay, so one way to remember is with the rule of 2s. So you brush thoroughly with fluoride toothpaste for 2 minutes, twice a day, and you visit your dentist twice a year. It's also important to know that even if you have no natural teeth or you have dentures or partials, you still need to visit your dentist regularly. It's also very important to floss daily. For patients that are unable to floss, we've got floss picks and other helpful tools such as water picks that can be used. And don't forget, common things that are easily forgotten while brushing are to remember to brush your tongue. Bacteria likes to adhere to your tongue and causes bad breath. And when flossing, it's important to not pop the floss in between your teeth. You're more likely to cause tissue damage. And you're going to use a C-shaped motion around one tooth and then the adjacent to actually kind of work that plaque and all that off of your tooth.
Okay, so I'm gonna go over this slide. So these are just some helpful hygiene and
Question before we go over that slide. I was when y'all said brushing the teeth, and you said a soft bristle brush. Would a sonic brush be like?
Mm-hmm.
yeah, it would be a soft bristle brush.
Okay.
So they do make head attachment for like the Philips Sonicare or Oral-B. They do make them in the medium head attachments. So just try to make it say soft. A lot of those don't feel soft, but it actually says soft. So that's actually what we would recommend for everyone is an electric toothbrush with a soft head.
Okay. So the helpful hygiene aids. So if a patient has like arthritis or they have problems using their hands or brushing their teeth in general, there's other helpful aids that'll make it a lot easier for them to be able to brush their teeth. And so we recommend an electric brush because the handle is wider. So it also, I have, and these are some pictures down here as well that correlate with it. So the larger handle just makes it a lot easier for them to use. You also wrap a towel around the toothbrush, so that gives them a thicker working feel. And then also, or duct tape. And then as you can see, there's also like tennis balls, and you can get creative, like putty, like all those kind of things can work for making it a little bit easier to grasp. And then also floss threaders make someone else's teeth, or if you're flossing someone else's teeth, using a floss threader will make it a lot easier because it gives you a longer range of motion when flossing. So this is an example of a floss threader. And you go through and thread the floss through it, and it just makes it a lot easier to go in between each tooth. And then we have what's called Proxa brushes. Those are great tools for people who have like open spaces in between their teeth, like this picture here. And these are the Proxa brushes. Those are really good for just going in between the teeth with open contacts and just cleaning in there really, really good.
All right, pregnancy and oral hygiene. So 40% of pregnant women have some form of periodontal disease. According to the CDC, gingivitis affects 60 to 75% of pregnant women. It's important, it is safe for pregnant women to go to the dentist and have x-rays. The best time to go for them would probably be during the second trimester. And you're also, so when you're pregnant, you're able, and if you have insurance, your insurance will cover three visits while you're pregnant. And then gingivitis can lead to periodontitis, which is linked to preterm delivery and low birth weight, and just a lot more complications. All right, infant oral care. So caregivers should brush their infant's teeth twice a day with a child's toothbrush or clean, damp infant washcloth. There's to use a smear layer, so the size of a grain of rice, of fluoridated toothpaste from infant to 3 years old. The lips should be lifted when cleaning the anterior teeth. It's also very important to know that a child needs to go to the dentist either when their first tooth erupts or at least by the age of 1. And then infants should never go to bed with milk left in their mouth because the milk will collect around their teeth and cause cavities in an early age.
So we're going to talk a little bit about dentures. So the bacteria can build up on the dentures if left unremoved for too long. So you want to make sure that dentures need to be taken out and soaked in a cleaning solution overnight, so that bacteria can't stay on there, or the bacteria will lead to aspiration if it's left on the dentures for too long. So dentures they're not as good as healthy teeth for chewing. So it may cause a risk for choking and aspiration of the airways because the biting forces and all that is a little bit, it's not the same as natural teeth. And so this is going to be a video. It's going to show us how to properly clean dentures for any of our patients.
In this video, we're going to teach you how to clean and care for your dentures. So after you eat, you're going to want to remove your dentures and you're going to want to rinse them off in lukewarm water. Just run a tap over them. And you might want to fill up your sink with a little bit of water so that if you drop your denture, it's not going to crack. We also recommend putting a towel down on the counter next to the sink. So again, if you drop it over here, it's not going to break your denture. Don't ever use hot water or boiling water because it could warp your denture and it might not fit anymore when you try to put it back in your mouth. So always be gentle and let the water do the cleaning. You do want to brush these at least daily, once a day, and you don't want to use any harsh cleaners, no bleach, not even toothpaste with whitening in it can be too abrasive for dentures. You'll also want to use a very soft bristled toothbrush. I have a little kid's toothbrush here because I know it's going to be super soft, and just gently You can use some denture cleaner for this, and you can gently brush and clean your denture. So if you use any adhesive in your denture, you'll want to make sure to get that cleaned out completely. And if you are using a denture cleanser to brush this with, you'll want to rinse this off completely before putting it in your mouth, because you don't want any of that cleanser in your mouth. It can cause vomiting, it could cause burns, lots of problems. So don't put that in your mouth. Rinse it completely again in the water with water in the basin. So after you're done cleaning that, you'll want to place it on a towel. It's not going to get broken. And you're going to want to clean your gums as well, again with a soft bristled toothbrush. If you use adhesive, make sure that all that is cleaned off of your gums. So at night, you're going to want to soak these, either in water or a mild denture soaking solution. Just place it in a cup overnight. So if you buy a mild denture soaking solution, there's usually instructions on the box that are specific to that manufacturer. So you'll want to read those on the box. Again, you'll want to rinse this off thoroughly so that you don't get any of that solution in your mouth the next day when you pull these out and get ready to wear them for the day. Always take them to the sink, rinse them off very well. We hope you've learned something today about taking care of your removable denture. If you like this video, please feel free.
So caring for patients with denture, I'm just going to kind of go back over kind of what she just talked about. So after the dentures are removed, they need to be cleaned manually to get off any bacteria and debris. And it's critical to keep the gums clean with a damp, soft toothbrush or a damp cloth to clean the mouth out. And don't forget to brush the tongue, as we said earlier. That's really, really important because that's where halitosis can come from, the bad breath smell. And you want to have patients, the patient can also rinse with the mouthwash to help clean as well, and soak the dentures in a water and cleaning solution. And then this is just an example of just a denture brush, but a soft toothbrush can also be used. And then this is just an example of some denture cleaner. So advice for patients with dentures. So you want to make sure they refrain from sleeping in their dentures at night, because it can cause a lot of soreness and tenderness on their gums, and we don't want that. You want to make sure the food needs to be cut into small pieces, because the biting forces are a lot different from natural teeth, so it makes it harder for them to chew, and they'll be more encouraged to eat foods that are higher in carbohydrates that'll be bad for their overall health. And so we want to make sure they're still encouraged. We want to encourage them to still be eating healthier foods for them, just trying to cut them into smaller pieces so that they can still enjoy them. And also you want to make sure that they drink lots of water so that they can avoid dry mouth, and then remove and rinse dentures after eating. And then the last thing we're going to talk about is pneumonia. So the oral cavity is a reservoir for respiratory infections. So it's vital to keep the oral cavity of any patients on a ventilator. You want to keep their mouth clean because we don't want them to aspirate any bacteria. So pooling of secretions should be minimized through regular drainage and suction. And you want to elevate the patient's head to a 30 to 45 degree angle, keep their mouth clean, brush their teeth twice daily. And if needed, you can use a chlorhexidine or foam swab, but those are not recommended. It's more recommended to use the actual mechanical removal of brushing the teeth twice a day.
Mm-hmm.
And now we're going to play a little Kahoot, so you can get your phones out, and we're going to kind of review and test you guys on what we just went over.
And another thing off the record, so it's really common, I've found, with patients sleeping overnight in their dentures is like the main thing you'll see. And also it seems like I've talked to a lot of people who are like, I'm tired of going to the dentist. I just want to rip all my teeth out. You know, my own father has said it. So just keeping in mind that those people will never be able to eat a steak again. Your chewing capacity goes down to about 10% once you go to dentures, and it doesn't save you doctor visits because that bone keeps deteriorating when there's no teeth holding it in place. And then now, instead of going to get a cavity filled, you've got to go get your denture relined. So.
Also, it messes up the taste. Like when you've got full dentures, it doesn't taste the same when you're eating either.
Mm-hmm. Keep going.
You can with the
I think y'all will do really good. I was like really expecting y'all to look bored to death, but it seemed like y'all were kind of interested. So
Well, I'm sure there's something that they've learned.
Who I wanna play?
Because I know every time I listen, I learn something too.
yeah. No rinsing after brushing. I know they learned that.
This is fluoride mouthwash.